Congratulations, today was your liposuction 360 procedure and you're ready to walk out of the office and start your recovery process. And I wanted to paint a picture for you so you know what to expect and know how you can get optimal healing. You'll walk out of here with your little sockies and your nightgown covering and your nice compressive spandex kind of buttoned up garment that we give to you that's compressing everything in there, and you'll go home to your bed with a nice big absorbent towel to protect it from anything that could be leaking. But you will be leaking for the first 3 days or longer through the opening sites that are created for the liposuction cannula and the drainage. So the first evening you should be confident that you'll be comfortable with pain control and you'll be relaxed and the drainage is handled. It's all just part of the process. Now you're thinking, well, how do I get the best results and how do I make sure this healing is the best for the next several weeks, right? We know liposuction takes 3, even 6 months before the final result's going to be seen, and you want to keep a compression of the tissue where the fat's been removed. In that section, we want to keep those two sides of that area compressed together. Why? Because we want that to heal together nice and tight. So think about this. All the fluid that I put in needs to come out. All that tissue needs to come together. What's it going to take? It's going to take a couple of things. One is constant compression. That spandex-like garment is going to be the key to wear 24 hours a day, except for when you're showering. To wear that to keep that tissue there, and it should be comfortable, number one. Number two is lymphatic massage is a great way to stimulate the fluid movement. So you have fluid that's sitting there that needs to come out. All of it can't come out through those openings where the cannula were used. So it has to come out through the normal way our body gets rid of excess fluid, or edema we call it, and it puts it from just under the skin layers into the venous system, and it does that through the lymphatics. Now if you imagine what it's like to have a Swedish massage or a deep tissue massage, don't think of that at all. Imagine you have a very soft toothbrush and you're just gonna lightly run it across your skin. That's how you move lymphatics. It's a very light kind of movement, but it takes some finesse and understanding of where the lymphatics flow and where they dump into the deep venous system so that your body can eventually eliminate that fluid from your body, and your skin where that surgery was and the rest of your body where it's ever can tighten down, and you can get the tissue coming together so you get the best result. So wearing the garment, having lymphatic massage starting generally the first week after the procedure, and continuing for as much as 6 or 8 weeks, maybe 2 sessions per week. So that first phase of, I like to call it, as much as even 8 weeks, where you want to be pretty much wearing that garment as much as possible, 24 hours a day, is important. After that, you can wear it less and less. Some people love to wear it and may even want to wear it a lot longer, just it feels so good and snug in there. But you can expect that you'll have bruising. The bruising will recede within probably a month. It may take a while because yes, there's always a little bit of bruising in that area, and it's a lot of tissue disruption that we did to make that new shape of your body, but it will be worth it. And then the final stage, of course, is where you prepare for the lifestyle that you were going to have now that you have a slimmer body, and the shopping. Of course, that's one of the main complaints. Doctor, I have to go shopping now for all these new clothes because I'm fitting very differently in my clothing. But you got to remember that the lifestyle of eating nutrient-rich foods that are high in micronutrient content and low in calories. This information I want you to have, and it's in a 14-page, fairly comprehensive, natural, non-surgical weight loss therapy information sheet that I've created for years of my experience in integrative medicine learning and how to keep your body from getting toxic over the years, but how to reverse that process through nutrition. And then of course exercise. There's various methods to do that, but that's got to be in your mindset. I'm going to, now that I have a new shape, keep the fat and keep the fat cells that want to expand and get bigger and try to come back into areas where they've been removed permanently. This is a permanent procedure. You'll get to see that the shape stay for as many years as you can keep your lifestyle optimal. I mentioned that you'll walk out feeling very comfortable. And the first evening and night through the night, you should be quite comfortable. Patients tell me they felt great through the night. Now, The medication oxycodone with acetaminophen, aka Percocet, is not a medicine you want to stay on for very long, because after 2 or 3 days, constipation is one of the main side effects of that. We want to wean you off of that and onto maybe a lesser pain reliever such as tramadol, and then onto an anti-inflammatory such as ibuprofen or meloxicam. Also, you may need some assistance with any of those symptoms that comes up, such as constipation, but also pain relief. And I love to connect with my patients the next day after the procedure to make sure you got everything you need. But there's nausea control medicine called ondansetron. It's very safe. Non-drowsy. We got the pain reliever, the anxiety medication. You don't need that anymore. And we've got the step-down pain relievers. And the antibiotic finishes out after about 1 week. So this medications you'll get even before you come to your procedure, but you'll have them all at home. You'll walk out with them, and you can expect to have a very easy recovery. I've had patients that return from liposuction to work within as early as 5 days. So you can expect probably 2 weeks if you're lifting and moving a lot, if it's an abdominal 360 lipo. But you can be back to full function within 2 weeks, even though you're wearing your compression garment. So I wish you the very best results. Be cautious with your shopping, because in another 3 months you will be shopping again, and have a great vacation when you're ready to get back in that swimsuit.